So Kevin has been an ER nurse for 15 years. He's done pediatric and adults. He's done emergency care and trauma education and leadership. He's a jack of all emergency trades. And he is also the host of Art of Emergency Nursing podcast. So we're so thankful you're here today.
Oh, thank you so much for having me, Chelsea. I really appreciate it.
So you're super passionate about educating nurses and future nurses. Tell us a little bit about you and what brought you to nursing to begin with.
So a little bit about me, when I finished high school, I wasn't really sure what I wanted to do. I thought I wanted to do something with taking care of people, but I just wasn't sure. Excuse me. So what I did was I decided to go volunteer at the hospital. I was working full-time at Motorola, of all places, and I hated my job. It was a production job, and it was just terrible. So I went and volunteered at the University of New Mexico Hospital and volunteered in their radiology department because I thought I wanted to be a radiology tech. What I found out was it was not the most exciting place in the world. But what I did see was that the emergency department was always a blast. There was always stuff going on. It was always crazy. So I thought to myself, okay, that'd be kind of cool. Mm-hmm. Fast forward a little while later, I was talking to, my mom was in the emergency department, and I was talking to the guy who was starting her IV. And I said, well, what do you do? Are you a nurse? He goes, no, I'm a tech. He's like, the techs do X, Y, and Z. And I'm like, hey, that sounds kind of cool. And he's like, yeah, it's the coolest job ever. So I was like, huh, okay, well, what do you got to do to get that job? He's like, well, go get your EMT. And I'm like, all right, okay. So I did. I went and got my EMT and then started working as a tech in the ER. And then it was locked in. I knew that I wanted to be a nurse. I knew that was what I was going to do. And I knew that emergency nursing was what I was going to do for, the rest of my career. So
that's awesome. What a fun stepping stone. And, that's a great place to start. So emergency room nurses always have the best stories. Tell us a funny story as your icebreaker.
Funny story. So I'll tell you about like one of my first days in the emergency department. So one of my first days in the emergency department, it was me and this guy named Micah's first day. And me and Micah were both, Micah had a lot of experience as a paramedic, but no experience in the hospital. I had experience in the hospital at Presbyterian of all places, and then moved over to UNM. So my first day, one of the nurses asked me and Micah if we wanted to go do an NG tube. And I was like, oh yeah, sure. Easy peasy. I've done 1 million NG tubes. We got this. So sure enough, we go do the NG tube, and I'm like fully gowned up. I got the hat, the face mask, the yellow gown, the whole 9 yards, gloves, full deal. Micah does too. And we go in there to do the NG tube, and it's going along, and we were trying to verify placement. And what we originally did to verify placement was what we used to do a long time ago is we used to either just inject in a little bit of air with your stethoscope over the stomach and see if you heard the gurgling. That was one way. Another way to do it was take your syringe, pull back, and see if you get gastric content. So take a 60 cc syringe and you pull it out and you get gastric content, you're good to go, right? You're in the stomach. So sure enough, I'm telling Micah this. I said, just pull back that syringe and see if you get anything. So he pulls back the 60 cc syringe and he gets 60 cc's of gastric, yellow, foul gastric content. So we're like, I'm like, you're good. You're in the stomach for sure. And this nurse comes up, this nurse Anita comes up, and Anita's like, wait. That's not how we verify placement. And I go, well, what do you want us to do? And she's like, you got to inject in the air. That's the way you do it. And I'm like, well, I'm pretty sure we're in the stomach. Like we're probably good. And she goes, nope. This is what you got to do it. So he takes off that Toomey syringe, and I start to explain to him to empty out the gastric content, pull the syringe back full of air. And I'm telling him this, and he's standing there with the syringe in his hand. He's already taken it off the NG tube. He's got his little thumb there trying to hold, make sure the gastric content doesn't come out. And just before I get a chance to tell him, empty it out first, and then we'll put in the air, he plugs it back up, puts that Toomey syringe back in the NG tube, and he goes to push it in. And I'm like, wait. And as soon as he pushes, it just goes everywhere. It just goes all over everywhere. it gets all over me, it gets all over him, and it gets all over poor Anita, who's just now covered in this gastric content. Now we were all gowned up, so we're sitting there going, huh, that's pretty gross. Anita is sitting there in a white shirt, and it's just soaked. And I'll never forget. She's just like, I'll be right back. And she just kind of walks off. And I was just like, this is our first day out. Like, I think it was our first day. Like, it was first week for sure. And I was like going, we're going to get fired. We're both going to get fired. This is terrible. And I was just like, and Micah's like, oh, we're done, dude. They're going to walk us out any minute now. Well, they didn't walk us out. Anita still hasn't forgiven me for that. But it sure did make a pretty funny story. So,
and Anita now comes in with an empty syringe to instruct her.
Yeah, and certainly gowns up, and she still brings it up. She brought it up, I don't know, maybe 6 months ago. She brought it up. She's like, "Do you remember that time?" And I'm like, "Yes, Anita, I remember that time."
That's amazing.
Yeah.
So I know from speaking with you that you strongly encourage nurses to join professional nursing organizations. Why is that?
I got to tell you, I think one of the most important things to do is to join a professional organization. Now, when I was a brand new baby nurse and I just got my nursing degree, I worked for a woman named Adrienne. And Adrienne, one of the things that Adrienne said, if you're a professional, you owe it to yourself and you owe it to your profession to be part of your professional organization. Mm-hmm. And I really took that to heart. So I joined right away. I joined the Emergency Nursing Association because I was going to be an ER nurse. And immediately started not only being a member, but being an active member. Now, and that's the thing is you can join an organization, but if you actually get involved in the organization, oh my God, it opens up so many doors. I've made so many friends from ENA that it's been an amazing opportunity. The opportunities and the experiences that have come from it are just incredible. So I recommend to everybody, students, if you're listening, join a professional organization. You owe it to yourself.
So we got tons of questions regarding, how do we choose and which ones do we choose and how many do we join and lots of things like that. So we're going to go through them as they kind of flow. But I think you get the opportunity because you're involved to speak at these professional nursing organizations. What's that experience like?
So I've had the opportunity to speak at the national level, which was incredible. It's incredible to be able to get in front of all your peers, people from all over the country, and try to teach them something. And it's intimidating and terrifying and exhilarating all at the same time. I've had the opportunity, the opportunities that have been presented to me being part of the Emergency Nursing Association. It has been incredible. I got involved at the state level when I was in New Mexico. I immediately started going. And soon after I started attending, they were like, "Hey, do you want to be on the board of directors?" I was like, "Oh yeah, for sure." So I joined the board of directors, eventually ran for president, became the state president for a while, kind of cycled in and out. One of the things we kind of joked about is that in New Mexico, we didn't have a whole lot of people that were super active involved in ENA. So it seemed like you kind of took your turn. You were the president, then you got to be the secretary, maybe you got to be the treasurer, and then maybe it was going to be your time to be the president again. And the secretary role I was okay at. I never was the treasurer, still haven't never been the treasurer. I don't want to be the treasurer. But have had the opportunity to serve as the president of the state organization. And now here in Houston, where I live now, I'm the president of the local chapter. The opportunities that it's opened up have been absolutely incredible. I've had the opportunity to participate in national meetings, national work groups, and have gotten a chance to meet people from all over the world. So
that's really neat. So those of us that aren't in emergency nursing, I'm a part of the American Nurses Association, but how do we gauge, there are so many different professional nursing organizations. Those who are just starting out and interested, how do you decide which organization's right for you?
So one of the things I think is really super important, and this goes for everything in life, is you will thrive when you find your tribe. And it's all about that. And social media makes it super easy for us to do that, but there's nothing like connecting with people in person. What I would tell you is I had the opportunity to go to the American Nursing Association local chapter in New Mexico, went to a couple of their meetings because I considered joining the New Mexico Nursing Association. And what I found was it just wasn't a great fit for me. They were great people. They were doing incredible work, but they weren't the kind of people that like I felt comfortable and I felt like I could be myself in. One of the things I found in emergency nursing, and I'll speak to that because that's what I know the best. Emergency nurses, a lot of us are a lot alike. We're all a little weird. We all have a little bit of, kind of a twisted sense of humor. But it really gives you an opportunity to find your tribe and then be with the people that are going to get you. Like, I'll never forget the first time I worked in the emergency department as a tech in the emergency department. I remember thinking to myself, like, these are my people. Like, these people think like me. They're like me. This is cool. And I found the same thing with the Emergency Nursing Association. If you find your tribe, doors will open. You'll have the opportunity to get involved in a lot of really cool things. So what I always tell people is try something out. Like, if you know what kind of nurse you want to be, if you're a nursing student and you say to yourself, I know that I want to be an OB nurse, well, consider joining an OB organization. If you're like, I got to be, if you say to me, Kevin, I got to be an emergency nurse, it's the only option for me, then join the Emergency Nursing Association. Join the association you think you're going to be, and it can always change. And if you're not sure, then join the American Nursing Association. Join the larger group. And again, they're like a larger group that serves all nurses. And they're an incredible group to get involved with. So you just got to find your fit. And sometimes that means going to a few meetings and seeing if the people there are a good fit for you.
So how do people find local meetings and when those take place?
So I'll give you a link. I'll share a link with you guys. I think it's nursing.org, has a great list of all the national organizations and then all the local organizations as well. What I would say is reach out to your local organization and find out when they meet. Everyone's meeting virtually now, so that makes it even easier. Get on a virtual meet even before you join the organization and just say, hey, I want to attend a meeting. Any organization is going to be happy to have you because they need people. They want people. So as soon as you say, hey, I want to come check it out and see if maybe this is a good fit for me, they're going to roll out the red carpet. They're going to make sure to get you invited. Now is a great time to do that when they're meeting virtually. You can do it from the comfort of your own home.
I totally agree. And I was looking through the list. Let's try that again. A few days ago, actually, I was reading through the availability of, there's bariatric organizations. There's everything from the finest detail in nursing. They're out there. So if you have a very specific specialty, like niche down and get in that specific organization. I love it.
Yeah. Find what makes you passionate. Find what makes you passionate, what you're passionate about. And then you'll maybe find other people who think the same way you do.
So. Yeah, absolutely. So question about cost. How much does it cost? And how many should I join if it's expensive? Those sorts of questions came through.
So we'll talk a little bit more about cost. Let's talk a little bit more about cost. So it costs anywhere from about $100 to about $200, depending on the organization, to join the national organizations. Now, some organizations, like I think the American Nursing Association, they charge you a national fee and then they charge you a local fee as well. And that brings the dues to the local level is what I think that's meant to do. A lot of organizations just have you join, costs anywhere from $100 to $200, depending on the organization. And then they then put you in a chapter that's closest to you. So when people ask me how many should I join, it depends. The answer to that is it depends. I think that there's opportunity everywhere, and if you have more than one specialty, then you have more than one passion, then it's easy to get involved in more than one group. But what I'll tell you is pick quality over quantity. So rather than be a member of 3 or 4 groups where all you're doing is just kind of paying dues and being part of the group. But find one where you can really be an active member. There's a big difference between people who pay their membership and they're a card carrying member, for instance, of the ENA. It's a lot of folks that have a card for the ENA and they're a member of the group. But there's others that show up to meetings every month. There's others that get actively involved, that get involved at the state level, get involved at the national level. And involvement can be whatever you want it to be. We have some people who get involved by, helping write textbooks, help writing exams, help writing content. We have other people who try to lead the organization in various levels, the chapter, state, and national level. So pick quality over quantity. If you want to join more than one, knock yourself out. Join more than one. I think I'm a member of 3 organizations. ENA is my primary. That's the one where I probably spend the most time. Like I said, I'm the chapter president this year for Houston. I've been a state president in the past. I've been involved in local committees, state committees, national committees, and boy, it's just opened up a ton of doors. Also a member of the Nursing Professional Development Organization. Had to think about that for a minute. Member of that organization as well. Not super active yet. Maybe I will be at some point when I have a little bit more bandwidth. But it was important for me as a nursing professional development, as a nurse educator, to be involved in that group. So.
And from what I understand, all these different groups have different opportunities for learning, CEUs, different presentations that you can build up your knowledge and your skill set.
Absolutely.
How exactly does that change your skills or advance your nursing knowledge based on the group that you're in?
Well, most of the organizations that have that are, especially for the specialties, most of the organizations for the specialties have CEs in their specialty. So for instance, the Emergency Nursing Association has the opportunity for free CEs every month. They have opportunity for paid CEs as well, but they have opportunity for free CEs every single month. And, you have unlimited content. Most organizations, you're going to get a journal, either a digital journal or a print journal that comes to your home. And there is where you're going to find best practice for your specialty. That's going to be where the research body is for your specialty. So for the Emergency Nursing Association, they have the GEN, and the GEN is the Journal of Emergency Nursing. And that's where anyone who's doing research about emergency nursing probably wants to post it there. That's where all the emergency nurses are going to see that literature and where they're going to help kind of shape that practice. So certainly there's a lot of opportunities.
And I think as professionals, we really should desire to be up on the latest and greatest research and development for our own professional development and practice. But I think nursing school, a lot of people, and as some students talked about this, that their takeaway from their professional educators was to join the American Nursing Association or a professional nursing organization because it's a good resume builder. But there's more to it than that. And as a member of one of these organizations, I hope that you would take more away from it than that.
So there is that. I mean, certainly it does look good on your resume. If you're applying for a specialty, if you want to be an OB nurse, and they look at your resume and they say, hey, this young lady who is a nursing student is already a member of our professional organization. She's already looking at the most up-to-date literature for our specialty. Certainly that's going to put you on a shorter list. Certainly that's going to boost you and make you look better. But it's more than about just that. I mean, it's nice to be a card-carrying member, but even cooler to be involved. Even cooler to be able to say, hey, you know what? So for every year, for instance, the Emergency Nursing Association every year does a national meeting. They do a national meeting where they take care of the business of the organization. And for, I don't even know how many years, I've been able to go to that national meeting, participate in that national meeting, and they give you these little keypads where you actually get to vote and shape the way the national organization is going. Now, how cool is that? to be able to say, hey, you know what? I get a chance to vote on something that's going to make a difference and bring practice forward for my specialty. And the more active you are, the more you get involved, and you find out that it's a really small world. One of the things I found going to conferences and going to the national meetings is I find out that, our ER is about as screwed up as everybody else is. Everybody has their issues and everybody has their, what the different inconsistencies in their emergency department or their organization.
Mm-hmm.
But you find out you're probably doing okay. Now there's some places that got it, that they're way ahead of you. There's some places that are right behind you. And we can all learn something from everybody. So it's a great place to visit and hear about best practice from around the country. I have a friend who lives in Virginia, and anytime I have any kind of questions she's an educator, and every time I have questions about education, about emergency nursing education, I'll call her up and I'll be like, hey, what are you guys doing around this? And she'll be like, oh, hey, we're doing this, this, and this. Or she'll call me and she'll be like, hey, have you heard anything about this? I'll be like, yeah, let me share with you what I have.
That's
I would have never met her had it not been through the national organization. One of our board members for the ENA is from the Netherlands. So every now and then I get a text message from a guy in the Netherlands who's telling me, hey, here's what we're doing. For you realize that it's a really, really small world. One of the things I love about the conferences and I love about the meetings is I get to go and I get to see people that I see maybe once or twice a year. But you know what? They're all like me. They all have jobs just like me. They're all doing stuff just like me. Mm-hmm. And that's super exciting. And that's what's going to that's what makes the difference between nursing being just a job that you go do and you do three to 5 days a week. And then being something bigger, making it really truly your career. So mm-hmm. I can't tell you, I can't. It's an amazing opportunity. You're crazy if you don't do it.
And so right now we're considered to be in the trenches. These nursing organizations are doing some pretty cool stuff for nurses right here and right now. You want to tell us a little bit about the things they've got in their pockets?
Sure. One of the things that, again, national organizations are all about supporting their members. So I'll tell you just a little bit about what one of the things we're seeing is, of course, COVID-19 is what's on everybody's mind, right? And every organization is processing the information that's coming out and saying, hey, here's what this means to you as a member of this organization. If you're in the emergency department, here's what you need to know about COVID-19. Mm-hmm. If you're an OB, here's what you need to know. You don't think about OB patients being potentially infectious. The OB groups are talking about that. The PEDS groups are talking about that. The Emergency Nursing Association has been super active in not only distributing out information around coronavirus and COVID-19, but they've been super forward thinking and putting out a page and updating the information all the time, referring people back to the CDC, having interpretations of what the CDC is putting out, and having position statements supporting nurses in the time when nurses need support probably the most ever. I mean, we are going through historic times. This is a time that well after we're done with our career, people will still talk about right now and the medicine that we're living through right now. And the professional organizations are forward thinking enough to say, hey, we need to be at the forefront of this. They're pushing out as much information as they can. They're getting as much information as they can out. And then one of the things that's really important is they're also lobbying for nurses and trying to support nurses at the legislative level. And that's another thing that professional organizations will do for you is they're going to lobby at the federal and national level, federal and state level, and basically give an opportunity to give your voice in front of the politicians who are making these decisions. That's critical. That's super critical. Like without that, what's the people in the trenches they're so busy, they got their head down. They don't have time to go hunt down their legislators. These professional organizations are doing that for you, and they're making it as easy as they can for you to then write letters and show your support for things. So
And some outward appreciation or token that they've given as well is free hotel rooms with the Hilton. They partnered with
Yeah,
the Hilton to provide lodging for members. It's amazing.
it's amazing. There, the support. I don't know if the rest of you guys are feeling as well supported as we are, and I know there's, and it varies where you're at, but I know that the community seems to be trying to support nursing and trying to be in favor of nursing. Free hotel rooms, free donuts, free shoes, free this, free that, discounted this and that. They're trying to come together for us, but part of that is our professional organizations going out and beating the drum and saying, "Hey, here's who's still out there, and this is what they're doing for you."
Yeah, it's great. It's amazing.
Yeah.
Lots of comments coming in from viewers just talking about how they appreciate the different things that professional organizations are doing. We see you, Pam, and yes, absolutely, it's on board. So if no other questions are going to come in, I want you to tell us a little bit about your podcast that you host, The Art of Emergency Nursing.
Sure. So thanks for letting me share a little bit about that. My podcast is called The Art of Emergency Nursing, and it's all about just that. It's the voice of emergency nursing. I got the idea for this podcast at a national ENA meeting. I was at a national ENA meeting, and I was sitting at a table with about 9 or 10 ER nurses from all over the country. And one of the things we found was we had a lot of shared experience. You had a tragic patient. I had a tragic patient. You had something hilarious happen. I had something hilarious happen. And a lot of our stories were very, very similar. And I just remember thinking to myself, this would make an interesting podcast. I would listen to this. So that's what I've done. I've created a podcast where I interview nurses from all over the world, and we tell stories. We tell stories about patients that have shaped their career, sometimes scarred their career, and issues that they've had. And what I think a lot of folks find in it is a little bit of a community. They find their tribe in that, as they're hearing about, as they're hearing about this nursing, tell the story about a patient that broke their heart. They're thinking to themselves, "Oh my gosh, I had the same patient. I had the same patient, and they broke my heart too." It's a shared experience. And the podcast has been, when I first came out with it, I thought it'd be me and my wife listening to it. And I'm happy to report that it's been a year, just over a year now. And it's been pretty popular. It's really gotten some traction. Get a lot of feedback from nursing students who think that they want to go into the emergency department. And it gives them a kind of an idea of what to expect. Because, being a nurse is tough. Being a nurse, no matter what your specialty is tough. Being an emergency nurse sometimes is really tough. And having a little bit of shared experience can help maybe prepare somebody for that. Then that makes it all worthwhile.
Absolutely. Yes, I will share the link to his podcast and all the links that we've discussed in the notes right after we close out here. I'm so glad that you shared all this information with us, including your podcast. I love what you're doing, and I love what you pour into nursing as a whole. Before we close out today, I want to hear your favorite nursing hack.
My favorite nursing hack. One thing before, can I plug one more thing before?
Yeah, please.
Now, okay, students, I posted in Tribe that if you listened, I would make this session, this Q&A, totally worth your time. And I'm getting ready to blow your mind. So here we are talking about joining a professional organization. If you think ER is your tribe, if you think you're an ER person and that's what you want to do, the Emergency Nursing Association right now has a deal between now and May 31st where nursing students with a .edu email address can join for free.
That's amazing.
Free. They can join for 1 year for free in the student level, and it's completely free. So we're going to have a link. We're going to put a link up in Tribe and give you guys an opportunity to join a professional organization. Again, like we said, it looks good on your resume. But more important than that, it's going to get you in free. If you go and be an active member, a lot of times when you show up to these meetings, these are decision makers in their ERs. They're educators, they're leaders. They're people who are influential in their units, and you're going to get a chance to meet people in the industry that you want to be in. So we're going to put a link there. There's a link. It's free for students again till May 31st. What I'm going to ask you guys to do, I'm going to ask you guys to put in, there's a place where it asks who referred you. I'm going to ask you to put my name in there, and I got a little number for you that we're going to put in there. I'm going to ask you to do that for me if you would. Because I want to see how many people end up joining from Tribe, because we got a lot of nursing students, and I think it's going to be pretty popular. So that's what I'm hoping for.
Super cool. I will share all of this stuff with you, Kevin. Thank you so much for that. That's amazing.
Now, are you ready for my nurse hack?
Yeah.
You told me you were going to ask me this question. I had a hard time coming up with just one, so I have two for you.
Okay.
One is one nursing hack that I think is super cool, and you can look for this on YouTube. One that I think is super cool. If you ever have somebody who has a ring that needs to come off, maybe if their finger's swollen, a lot of times we'll just cut the ring. A lot of times we'll just take a little saw, we'll cut that ring off. But there's a way you can do it with some string, with maybe the rubber band from your oxygen mask, or maybe a little bit of umbilical tape. And there's a cool little trick where you can wrap the finger and wrap the string around and get the ring off without cutting it. That's one of my favorite emergency nursing hacks.
It's a good one.
My other favorite hack will save anybody, not just for the ER, but anybody, is one of the things that will just nuke stinky feet. If your patient has really stinky feet, or maybe they got a stinky bottom, maybe they had lots of, made a little mess, and they have a stinky bottom, they have a stinky feet. One of the things that after you get them all cleaned up, if you put a little bit of shaving cream on there, massage in a little shaving cream, maybe let the shaving cream kind of sit on the feet for a little while and then wipe it off, it will nuke the smell. It just takes care of the smell, takes it right out. It's amazing. It's an amazing nurse hack that everybody needs to know, because we all have sometimes stinky patients. So
absolutely. Well, Kevin, thank you so much for joining. Listeners, thank you so much for tuning in. You guys have an amazing night.
Thank you so much for having me. I appreciate it. And I appreciate all the work you do for Tribe. And I appreciate Tribe. You guys charge my batteries. I really appreciate it. And I appreciate all the people in there. And I appreciate you for bringing this group together.
Thank you so much. I'm proud of you guys. Oh,
wait. And I didn't get a chance to put it on, but
that's amazing.
Cool is that? The coolest Tribe RN shirt out there. This is
awesome.
Cool. Thanks,
Kevin.
I love it. Thank you so much.
Awesome. You guys have a good one. Thanks for joining us.
Thanks so much. Have a good one.